Fantastic. Well, first, hello to everybody, and great to be back together after a tremendous day of speeches and very, very interesting interventions. And we're going to talk about what happened in the breakout sessions today, which is very important for us. We had all sorts of excellent ideas, President Frederick, about how our network can move forward. We heard from Mayor Peduto of Pittsburgh. We heard from senior officials in the administration and some fantastic civil society leaders about what we ought to be doing to promote sustainable development goals around the country. And now we're thrilled that you are addressing us and helping to guide us. President Wayne Frederick, of course, is president of Howard University, and also we're thrilled to say a member of the Leadership Council of the Sustainable Development Solutions Network USA. He is often returning from surgery when he comes on the line, so he is doubling or tripling as a surgeon, global thought leader, and president of a great university, and is absolutely committed to this agenda, and especially to social inclusion and racial justice and access for all to social services, universal health coverage, and our other goals. We're really thrilled to have you with us, President Frederick. Thank you so much. And let me give you the mic, and we're listening attentively.
Sure. Thanks again for having me. I look forward to the Q&A session. First, let me thank you, Jeff, your collegiality and the work that you've been doing at the forefront of very much necessary work. One of my professors is a part of your council, Dr. Bond, so I want to take an opportunity as well. And to thank all of you participate in the network. I think this is very much needed discussion. You know, I think our colleges and universities have probably never been as important as today, in my opinion. One of the things that we must recognize is that we cannot isolate ourselves in our ivory towers, however. Education has to be for a purpose. It always should be. And our colleges and universities have to continue to be mission driven. So we must be at the forefront of not just producing thought leaders, but being thought leaders. We must be advancing research into better solutions, and then taking that to make sure that we're change makers. And I think one of the things that we have seen in this pandemic is just how important our universities are. Look at how many things in this pandemic our universities have participated in. So whether it's vaccine production, the vaccine research that has led to that, at Howard University, we've stood up a vaccination center to be able to provide vaccines for the community. We stood up testing centers as well. So we must be really embedded in our society and making a difference. We can't just simply be here for the sake of scholarly activity. Now, what is just as important is we must always reflect on our history. And in reflecting on our history, one of the things that we will quickly see is that our democracy is messy, but it works. And I know that it's tough at times like this to believe in that, but I do. And that's because Howard's birth in and of itself is a demonstration of that. Howard's charter was signed on March 2nd, 1867. 17 men from the Congregational Church got together 5 years after starting the Freedmen's Hospital, which predated our university here on our campus, and petitioned Congress to support our university to educate freed slaves moving from the South. Now, why is that important? It was important for several reasons. One is that one of those men was General Oliver Otis Howard, for whom we're named. He fought in the Civil War, lost his arm, and then was running the Freedmen's Bureau. So the first and only federally chartered historically Black college and university in this country is actually Howard University. The president that would sign that charter was the 17th president of the United States, Andrew Johnson, who has now been made famous because he is not the most impeached president. He will remain the first impeached president. And on the same day that he signed the charter, he vetoed the first Reconstruction Act. He did not believe that freed slaves moving from the South needed a place to be educated. Yet still, he signed a charter over 153 years ago that led to and a university that would be the place that would bring the coming of age of the first Black female vice president of our country, Kamala Harris. So just think about that. Somebody who his juxtaposition on the political spectrum couldn't be more different from the first female vice president, actually created a university that would educate her. And that's why I say our democracy is sometimes messy, but it does work. And I think one of the things that we have as a responsibility as our institutions is to restore our faith in our system, but to recognize that our system is not just a system, but it is about people. And what we have to do is to restore that faith in people. So that brings me to the fact that when we talk about equities, we must understand what we're talking about. It's not just about the numbers of people, but it's about what we allow people to be able to attain, to reach, to use, and how they then can live when we do that. So I think the sustainability efforts and the goals are critical when you look at that. So when we look at a community, it's not a one size fits all. And I think in the pandemic, with the disproportionate impact, we recognize that we have to think about things differently. We talk a lot about physician shortages. And I agree as a practicing surgeon that we do have a potential physician shortage. What I disagree with, though, is the solution to that. The solution to that right now seems to be to build more medical schools and have more medical students come in. I would argue that we actually have a healthcare system that if we remove the physicians from being the center of that healthcare system and we put the patient back at the center, we actually would then come up with more sustainable ideas about our healthcare system. So let me get specific. If you come to my vaccination center at Howard, what you will find are medical students alongside nursing students, pharmacy students, and dental students administering the vaccines to the patients. And if you then extrapolate that to how we deliver care, think of how many times each of us over the course of a year go to a pharmacy. We want everybody to go to the dentist at least once a year, if not twice, for good health. And when you start extrapolating that and you recognize that when you go to the dentist, you can get your blood pressure checked. You can get screened for diabetes. That does not have to happen in a physician's office. Then you immediately begin to recognize that by putting the patient and making everything as convenient for the patient, you begin to build a sustainable healthcare system. You begin to build a sustainable system that benefits the patient, prioritizes the patient and his or her movements, and therefore allows for access beyond what you would think is possible the way we currently do it. And this can be thought of in so many different areas, but our universities in particular must recognize that. We also must make different decisions. During the pandemic, we took an economic hit like everyone else, but I made a decision very early on that we would not furlough faculty or staff, and we would not lay anyone off. And so we did that. As a matter of fact, just a month ago, I also decided we'd give a 3% raise to our faculty. So somebody might say that's why you should be a surgeon and not be running a university because you're going to run it into the ground. But actually, again, I think sometimes when we think about sustainability, we don't think about investment. We don't think about investing in our people or investing in things. We always think that if we spend more money, there's going to be a shorthand, as opposed to thinking about the fact that disproportionately, African Americans were impacted by the COVID-19 and the recession. Black unemployment continues to be significantly more than the unemployment rate that we represent. And so my thought about it was, we already have, we hire and employ more African American faculty than any other higher institution in America. And so my thought process about it was that, why don't we, to make this a sustainable institution and situation, why don't we invest in our people at a time when they're hurting the most? And that way we can therefore give the university an opportunity to thrive. And that actually has benefited our finances in more ways than one. And so when we think about climate change and those types of things, and we hear arguments against the investment that's necessary, we must recognize that that's not what we should do. Now, I recognize that we don't live in a utopia. So let me be very clear about that. It is not lost on me that while these are good ideas and the sustainability goals are great, that there has to be some pragmatic things that get us there. But what we must not take out of it, though, is the burning passion of young people. And that's probably the most important thing that I think our universities are a cauldron for. So we ask students here at Howard about their mission, not their major, because we feel very strongly that students should be focused on their mission. And the more interdisciplinary exposure they get, and the more interdisciplinary nature of what we set up in our education, the better the outcome would be. Because ultimately, these young people have a vision and a passion that's beyond what we see. When you get to my age, you get jaded. Everything you see is a problem and a risk. And that's the good thing about young people. They see a cliff and they see a bridge, or they see a parasail, but they see something different. And so what we must do is to make sure that that pilot light, that little flame that's in them burns brightly. And the way we do that is we must expose them to our communities. We must let them recognize that what they're learning in the classroom must be applied elsewhere. And so when they come to Howard, they don't come to get a degree, they come to get an education. And that education only comes alive when they go out and serve the world around them. So I still believe that in America, opportunity is one of the greatest things that it provides. And without a doubt, our education system, I think, is the best inkwell for that opportunity, without a doubt. And of course, I'm biased because I think here at Howard University, we've signed that contract and a lot of that ink. But I think all of our universities in America today certainly do that. And so thanks for listening to me today, and I'm happy to take any questions. I think Jeff is going to lead a Q&A. So thanks again for having me, Jeff.
Thank you so much, and congratulations on delivering our excellent vice president. We're really grateful that we have a Howard alumna, and Vice President Harris is a great tribute to Howard and a great great leader for the country. And so this is a wonderful contribution. I loved what you said, but is it literally the case that students declare a mission? Because what a great idea.
Yeah, we talk about it. I'd like to move it to the fact that they should declare a mission.
Yeah, I love that idea, by the way.
I appreciate that. One of the reasons too, I stumbled on this. The number of students who are double majors at Howard amazes me. So we actually get dinged on our 4-year graduation rate because we have lots of students who stay a 5th year because they're double majors.
Yeah.
So even the way the education system counts, so they take away the incentive. I mean, for us, when I report the graduation rate, I think this isn't right. And when I look at the number of kids who do double majors, I'm like, wow. But that says to me that they are interested in interdisciplinary learning. They are interested in more of a mission as opposed to whatever the major is, and the majors don't quite, connect them. So it is something that we're looking at. And I think the more we focus there, the more we'll free young people to really achieve great things.
I think it's an amazing idea, actually, and would really help focus the minds in a very purposeful way to declare what's your mission, and to work with an advisor on honing that mission for your period of study, and having something in the community or public policy or something alongside that. So I want to encourage that. And if you ever want brainstorming on that, I want to jump in on that. And I love the idea. I've never heard it before, and I think it's a fantastic idea. I want to also pick up, if I could, on the question about redesigning healthcare, which we need to do in general, because our healthcare system is in general disconnected from people. It's incredibly expensive. It is intervention focused rather than health focused. A lot of the major university medical schools are in poor communities and don't really even know the poor communities. They don't know the communities around them, except that people show up at the emergency room. But in terms of outreach or understanding the real lives of the people in the neighborhoods, that's not their thing.
Yeah.
And so I think that this is a general issue, but I wonder whether we could, and then there's a specific issue about underserved communities. So in general, we find the data, of course, health situation of African Americans, of people of color, considerably worse, access considerably worse. And so I wonder about an active program of the network with your lead to think about redesigning systems to address the general structural problem, but specifically the problem of people who are not accessing the healthcare that they need. I also have seen, and I wonder your views about it. We're very keen on, active community outreach, even beyond the dentist's office. So ways to help people with their prescriptions. Of course, in New York, we have so many people that English is not a first or even a second language, and so meeting basic needs of adhering to prescriptions and so forth, big challenge. And there's very little community outreach. We found in a lot of work that we've done in development projects that community health workers can play a great role in that, in connecting facilities with the communities. And I wonder if you have experience in that or ideas about that, but I would love
Oh,
for us to take on this challenge
yeah.
of redesign. It is SDG 3 after all.
So there are three things that I give you, and these are very different ideas. So I'm happy for anybody to challenge me on them. A couple of years ago, I went to my nursing and allied health school, and I said, "Listen, why don't we get our nutritional science department students to shop with residents who live in a food desert?" Because to be quite honest, in Ward 7 and 8 in DC, there are 170,000 residents, two full service groceries. They do most of their shopping at corner stores. So my idea was they would go with them to the grocery, plan out a week or two's worth of meals and read the labels, etc. So needless to say, my idea was fairly pedestrian, as the students would say. And then they would send that information to the PCP, because if you think about it, primary care physicians, you go to see a primary care physician for an annual checkup and they say, how has your nutrition been? And you think of the last 3 healthy meals you've had, and you say, oh, I've been eating well. I had a salad, I think 2 weeks ago, so I'm good. But the point is here, you really want longitudinal data. What my students and their faculty did is they went to the corner stores and spoke to the owners, and they also shopped with the residents. And sure enough, not everything in the corner store is bad, and that's what people can afford, and that's what they have access to. So meet them where they are. But that brings up a bigger issue, which is the way we teach about medicine and healthcare is disjointed. If we put the patient back at the center, then we should teach everybody in an interprofessional environment. And so the other thing that I think the network could look at is how often can we connect to the community and can we do something innovative? And so my suggestion would be Howard has a nursing school, allied health, pharmacy, medicine, dentistry, and I recognize that everybody doesn't have all of those assets. But at a place like Howard, what if we gave a family to all 4 of those disciplines, 1 student assigned, so 4 students from each of those disciplines assigned to 1 family from the first day you come into med school. So you get to follow them longitudinally. You get to see the kids. You get to, so every time, and you meet, once or twice a week, and you plan together what the interventions are, et cetera. Just think of the types of healthcare providers we will then produce who will be willing to pick up the phone and call their pharmacist, because they will see their pharmacist as a partner and not somebody that we write illegible prescriptions and they have to figure it out. And so I think that changing our mindset about how we teach it would also mean the culture of how we implement it would be different. And then the third thing, which probably is going to get the least traction, but I think would probably make the biggest difference, is I think everybody who finishes med school should have a designation as a primary care physician. Mm-hmm. So I think if you really focus on the preclinical work in the first 2 years, but you redesign the next 2 years, even a 5th year, so that you make it an amalgam of clinical experiences along with training, then everybody is a primary care physician and can hang their shingle when they're finished If you want to go do surgery like I did, then you could go do all those other things. But there's no reason, if I was appropriately trained through that system, when I see a patient, why can't I look at their blood pressure, their diabetes screening, etc. Again, changing it so that we always are giving the patient every option to get something better, from us, to make sure that we are meeting them where they are. They don't have to come to, so they don't, if they come to my office now and they have high blood pressure, I send them to someone else or the emergency room. That's how our system is designed, which doesn't make sense to me. If I was trained appropriately in the other form, they would get their treatment right where they come. And that's what frustrates people as well. They say, well, I went to the doctor. They don't care that I'm a cancer surgeon. That's not their concern, right? And so I think that all of those, and the sustainability part about this, I think, because I've been listening to you very carefully, Jeff, and reading a lot of your writings. The sustainability part of this is maximizing the work of the people that we already have in the system. I think a lot of times there's wasted effort, and we're a little apprehensive to talk about the wasted effort. And what we should be thinking is, okay, we need more resources. I agree, but let's look at the resources we have.
Yeah.
And let's beg ourselves of the question, are we maximizing the personnel and other resources we have? And let's look for innovative ways to really expand the reach of it. And I think if we are really thoughtful about that, we can get to a very different place. I mean, healthcare is one, and as you said, SDG3 is one of those, but there's so many things that I've seen and heard you talk about that I think we can apply, but we have to have a community, and we have to make sure that we push that community. Last thing I would say is culture is two things: it's people and tolerated behavior. And so it's not always that there's bad culture, but sometimes we tolerate bad behavior. And if we get rid of the bad behavior that we tolerate, we probably get, great culture.
I think you're on to some really huge and important ideas. I really do. And, 100 years ago, it's actually almost exactly 100 years ago that clinical medicine was reformed in teaching the Flexner plans and so forth. And that led to definitely a, more science-based medicine with important contributions. But this is a more human-based medicine, which we definitely need. And I've learned about this firsthand, I might say, because my wife is a pediatrician, and a good pediatrician treats the family, not the child, because you cannot help a child without understanding the full context.
Absolutely.
What's happening in the home? What's happening in the family? How do you help the family to help the child?
Yeah.
And so I love the idea of getting students engaged. That's a mission for them from the beginning, whether it's from the nursing school or the medical school, because they won't necessarily understand this stuff by just doing normal physiology and so on.
Yeah.
And especially this interaction with nutrition, because we know how much chronic disease is really secondary to nutritional challenges and preventable ones, where help and advice and guidance and holding hands basically to help families do better could make a huge difference. So I love the vision. I really would like you to take it on, and if we could help, I think it could make a huge breakthrough in how to re-envision universal health coverage, basically holistically. And I think you have a very strong case to make, and we should get the CDC, Doris Duke Foundation, others engaged to help you do it. I'd make the case also back to Rockefeller Foundation and others that they supported Flexner 100 years ago. They should support Frederick this time to say this is individual-based, person-based, human-based medicine. At least try it in the Howard area.
Yeah.
So
and as you pointed out, a lot of our major universities, just like Columbia. I mean, you think of, if you give every student who came in a family to follow longitudinally in that area, also the connection to the community is very different as well.
Exactly.
The community sees the benefit of Columbia. And to your point, when that person shows up in the ER, they probably already called your medical student to say that I'm on my way to the ER. The medical student probably has more information by the time they get there
No,
that can help.
it's really amazing because first of all, it's a great labor force, untapped. And second, what these students would learn for their lifetime, in addition to helping the families during this period, but what they would learn for a lifetime about true healthcare
Mm.
is phenomenal. So, okay, I want to follow up. I want us to follow up with you.
Sure.
Thank
No,
you. Thank
thanks
you.
for having me.
Yeah, thank you so much for the inspiration and the great ideas, and we'll follow up on that. And I know everyone, please give a round of applause.
Thank you.
Fantastic. Talk to you soon.
All right. Take care.
Thank
Bye.
you very much. Great. Thanks.